Alright, there's an order for a fully catheter insertion on my female patient. I've gathered all my supplies, I've double checked the order, and medicated my client 30 minutes prior and informed her of the procedure. Okay. Hi Mrs. Smith, I'm here to insert your Foley catheter. And how are you feeling? Do you have any pain? No? Excellent. Alrighty. I'm just going to set my supplies down. Form hand hygiene. And can you tell me your name and date of birth?
Yeah, maybe.
And I check and it matches her armband and the chart as well. So I perform hand hygiene. I'm going to put on non-sterile gloves. And do you have any allergies to latex or betadine or anything else?
No.
No, she doesn't. Fantastic. And I'm just going to clean my surface. Okay. And I let my surface dry completely. And here. And I provided privacy for the patient. I'm just going to raise your bed to a comfortable working height. Great. And privacy is provided. I'm going to lift your gown. I'm going to put a blanket on the lower half of the patient's body just to keep her warm and to make her feel a little bit more privacy has been given to her. Okay. And then if you could just move your legs to the side for me. All right. And are you comfortable? Good. And I'm going to tuck this under your bottom, okay? Can you lift your hips for me? Great, thank you. Okay. And then I'm going to remove my non-sterile gloves, perform hand hygiene. Touch just the last 2 inches.
But also just for their own. I mean, it's not actually like. Oh no. If they don't stay, well, so do you want to drive the camera? How many rooms do you have?
Okay.
I'm sorry.
Okay. And I put on my sterile gloves. And I don't need the fenestrated drape. I'm going to put this in place. I'm going to reach inside to protect my sterile gloves. And without compromising my sterile field, put that on the patient. Excellent. And I don't need a urine sample today, so I'm going to throw that away. I open my alcohol swabs. And I'm just going to once more check the gauge of my catheter to make sure it actually matches up with what's on the order. I'm going to attach my 10 mils of sterile water to my catheter. And I'm going to put my lubricant into the box. And this is not part of my sterile procedure, but this is just for our lab for the mannequin. I'm going to lube up my Foley to insert because the mannequin gets a little sticky. So pretend this isn't happening. Right, so everything in here is sterile. I'm going to move my sterile box over to my patient. All right, and I'm just going to touch your perineal area, okay, and I'm going to clean it up. I'm going to take my non-dominant hand and it's going to become non-sterile as I spread the patient's labia. And I'm going to clean with one swab on one side, from front to back, and on the other side, front to back, and down the center, around the urethral meatus. Okay. And then I would dip the tip of the catheter into the lubricant and also lubricate the urethral meatus. If it were a male, I would do the lidocaine. If it was ordered, I would insert lidocaine into the urethral meatus of the penis. But we're not going to do that here, because our patient is a female. So I'm going to spread the labia with my non-sterile glove. And insert the catheter into the urethral meatus. And once I see the flow of urine, I'm going to advance another 2 inches for my female patient. For a male patient, I would advance the catheter all the way up to the bifurcation. Now that I've advanced 2 more inches into the bladder, I inject 10 ml of sterile water while stabilizing the catheter with my non-dominant left hand. And then I disconnect my syringe. That is trash. And it is firmly in place. I label the bag appropriately. And I can set this here, and I'm going to secure the bag with a catheter securer, or I could also use tape when appropriate. And I secure the catheter to the thigh. And attach the bag. Not to the handrail, but to the actual metal attachment meant for the catheter bag. And everything is non-sterile. I'm going to remove all of my trash and lift your hips for me. Remove the straight. And reposition my patient so that she's comfortable and provide privacy. Cover her up. Remove all of my supplies. Remove my non-sterile gloves. I'd bring the patient's bed back down, give her her call light, anything she might need, and I would document the type of catheter I put in, and the French size. And if I had a urine sample, I would submit that and document the patient's tolerance for the procedure, and then perform hand hygiene and leave.